Plantar Fasciitis, Then and Now, Understanding Heel Pain. Hello, everyone, and welcome. Today, we're diving deep into the topic of plantar fasciitis, a common foot ailment that affects many people, especially runners. We'll start by looking back at how this condition was understood in the classic running book, Lore of Running, and then we'll explore the latest research and treatments available today. In Lore of Running, specifically Chapter 14, which discusses the diagnosis and treatment of injuries, plantar fasciitis is noted as one of the less common running injuries, accounting for about 5 to 14% of all running-related injuries. The primary symptom described is pain directly in front of the heel, often first noticed during running and then upon rising from rest, especially in the morning. A characteristic altered gait is observed, where the individual tends to hobble, avoiding ankle extension and push-off with the big toe. This first-step pain is a hallmark symptom. The book suggests that the mechanism of injury is linked to excessive subtalar joint pronation, causing a stretching of the plantar fascia. However, it also acknowledges that this concept lacked definitive confirmation at the time. An alternative view suggested that individuals with high arches might also be prone to this condition. Treatment recommendations in Lore of Running focused on addressing the believed cause of excessive ankle pronation, similar to treatments for runner's knee and Achilles tendonitis. This included orthotics and calf muscle stretching. Surgery was mentioned as a potential option for persistent cases lasting over 12 months. It's important to remember that this information reflects the understanding of plantar fasciitis at the time the book was written, which was several decades ago. Now, let's move on to the current understanding of plantar fasciitis, which has evolved significantly. Today, it's known as the most common cause of heel pain in adults, with a lifetime incidence of around 10%. It can affect both feet simultaneously in about 1/3 of cases. Epidemiology shows an incidence of about 3.83 cases per 1,000 patient years, with a higher prevalence in females. In the U.S., it affects an estimated 2 million people annually, leading to over 1 million clinical visits. The primary causes are repetitive microtrauma and biomechanical overuse, with reduced ankle dorsiflexion and tight calf muscles being significant risk factors. Secondary causes include obesity, occupations requiring prolonged standing, pre-existing foot conditions like flat feet or high arches, and improper footwear. Age, hormonal changes, and sudden weight gain also play a role. Symptoms include sharp, stabbing pain in the heel, especially with the first few steps in the morning. The pain can worsen after prolonged standing or activity. Over time, the pain can increase, potentially radiating up into the foot and ankle. Research has identified 3 stages: thickening of the plantar fascia, aggravation of the heel fat pad, and heel bone bruising. Prevention strategies include wearing supportive shoes, especially during activities, avoiding worn-out shoes and walking barefoot on hard surfaces, and using orthotic inserts. Training techniques should include thorough warm-ups, stretching, and gradual increases in intensity. Lifestyle modifications such as maintaining a healthy weight and taking regular breaks during prolonged standing are also important. Current treatment options range from conservative approaches like rest, ice, stretching, and physical therapy to more advanced interventions like corticosteroid injections, platelet-rich plasma, PRP injections, and extracorporeal shockwave therapy, ESWT. Surgery is considered a last resort for chronic cases. Recovery time varies widely from a few days to several years, but most individuals recover within several months of consistent conservative treatment. Factors influencing recovery include early treatment, the severity of damage, and adherence to the treatment plan. Recent advancements in physiotherapy include ESWT, dry needling with electrotherapy, and various taping techniques. High-intensity laser therapy and other manual therapies have also shown positive results. Minimally invasive surgical procedures like endoscopic plantar fasciotomy and the 10X procedure are becoming standard. Injection therapies have evolved with a shift towards PRP and dextrose prolotherapy. Diagnostic capabilities have improved with the use of ultrasound and sonelastography. In conclusion, plantar fasciitis is a common and often debilitating condition, with our understanding and treatment options having significantly advanced since the time of Lore of Running. Early diagnosis and a comprehensive tailored treatment plan are crucial for optimizing recovery. If you found this video helpful, please give it a like, leave a comment, and don't forget to subscribe to my channel for more informative content. Thank you for watching.